Hey, welcome to the Healthy Postnatal Body Podcast with your postnatal expert, Peter Lab. That, as always, will be me. This is a podcast for the 23rd of Feb 2025, and day before music means I have a guest on. Today I am talking to Brehan Crawford. You're going to love this one. This is fascinating. We're talking traditional Chinese medicine and how it relates to postpartum recovery and all that sort of stuff. And we're talking a lot more than that. We're talking about the difference between TCM, the real stuff, and the American style, almost traditional Chinese medicine that mainly tries to sell you stuff. The things that work, the things that don't work, what you should be looking out for, how it can help your postpartum recovery, what sort of things you should be doing postpartum according to traditional Chinese medicine, what things you should be avoiding. This ties in very nicely with the Sao Yesu, the Sitting the Month episodes we've done previously with GM Whitley, with Gongming Whitley and others, because I've done a few of these now. You're going to love this one. So without further ado, here we go. What is the difference between American traditional Chinese medicine and traditional Chinese medicine?
Yeah, I think there's two main differences to speak to. First of all, in China, the profession of Chinese medicine provider, whether it's acupuncturist or herbalist, and those professions are generally separate from each other. In the United States, most people who go to Chinese medicine school will do both modalities in their practice to one degree or the other, but acupuncture is much more common in the West. In China, people do one or the other. And then the profession is a very professional education. So when you graduate from medical school in China, even if it's a Chinese medicine school, you have the equivalent of an MD. Right. And you can go and do, a surgical residency. You can get prescription privileges for pharmaceutical medication as a Chinese medicine provider, things like that. Vice versa, you can go to Western medical school and then do a Chinese medicine residency and go into practice doing acupuncture or prescribing herbs. In the West, it's very often more like a trade school kind of approach. They are graduate schools. I went to one in the United States, got a master's degree. You can get doctoral degrees now. But the quality of the education is not the same as what you would consider, for a medical doctor. And then the clinical experience and training was what I found the largest difference to be when I went to China, is that, it's a very rigorous professional field. And I was lucky to get a residency here in the United States and really with a mentor who really busted my chops and made sure that I knew what I was doing and that I was competent to manage very complex cases in my specialty. That's an uncommon experience in the West. And so a lot of people go to China and are shocked to see the level of professionalism that is embodied by the medicine, the level of scientific knowledge that is embodied by most of the providers there, and how much scientific research has gone into understanding the mechanisms of Chinese medicine over the last 40 years in Asia. The governments of China, Japan, and Korea particularly have invested dozens of billions of dollars into researching traditional medicine there. And so we actually have a great wealth of scientific data showing exactly how it is that herbs work, that acupuncture works, that qigong, breathing exercises, and gentle movement work. And so that's one of the largest differences. The other one, though, is a lot more subtle, and it's that Chinese medicine is inseparable from Chinese culture. And if you're not, obviously I'm not Chinese, if you don't come from a Chinese family, or you don't go to China and see how the medicine is practiced in its native environment, in its indigenous environment, and how well integrated it is into everyday life in China, you don't really get a chance to appreciate how Chinese medicine is just part of Chinese culture. And so while we have all the professional aspects around it, we have certifications and degrees and fancy titles and we have scientific evidence and all that, the actual day-to-day life in people in China involves the use of a lot of Chinese medicine aspects. And that goes into things like how you cook your food. Right. Food is often cooked with Chinese herbs, things, and we cook with herbs in the West with garlic, rosemary, chili spices, things that have medicinal benefits to them, but we don't often think in terms of diagnosis and treatment when we're creating a meal. We just think what's going to taste good, and in China, those flavor aspects of spices especially are very closely linked to their medicinal benefits and their medicinal actions. And so in certain climates, you'll see people using certain kinds of flavors, which then become known as the cuisine of that region. So, southern China, especially where it's very humid, very sticky, very damp, people will use a lot of really hot, pungent spices because those things are antifungal. They have a way of warming up your body as a whole, drying your body as a whole, so that you can survive in a climate that's just riddled with mold everywhere. Whereas in northern China, they're eating a lot more rich food because it's cold, but it's also very dry. So they'll have there'll be a lot more rich stuff like lamb. Like wheat, like some of that, it looks more like Russian food, what we would think of as like Russian food or Central Asian food, Mongolian food, than what we think of as than what most Americans are exposed to as Chinese food in the West. It's certainly not like deep fried breaded meat covered in sugar sauce, but there's still a lot of vegetables, but it's much more somewhere between like Central Asia, Northern Asia, and Middle Eastern food. And there's a lot of influences there from the Silk Road too. And those things all have medicinal benefits. So, people are struggling from what we would consider very damp conditions in the West, whether it's, endocrine system issues like hypothalamic pituitary adrenal axis disorders or mold illness, mold-based injury, things like that. We're going to use a lot of hot, spicy, aromatic herbs in their formula because those volatiles all have actions about warming up the body, about improving water metabolism so that things aren't so sludgy and mucousy, and mold spores and mycelium don't really like those aromatic elements. We can use that to get that out of the body if somebody's got a fungal infection. And then also things like feng shui. The way that people design cities, the way that people design houses and living environments, feng shui, that is a two-character word. It literally, feng means wind and shui means water. So it's literally how is air and water moving through your house. And we talk about, again, mold. I'm coming back to that a lot. If you design your house with a leaky roof and not a good foundation, you're going to get mold growth all throughout it. You're going to get problems. And when you have adequate air movement, that's, and things are allowed to breathe, that's a much healthier environment for people.
Yeah. And that's there's a lot of fascinating stuff you touched on there, because one of the interviews, and I just tried to find it and I still can't remember. I'll put it in the footnotes that I did before with, doctor we discussed right before we went on air, so to speak, as if we so called podcast being on air. She was saying that a lot of the Chinese medicine hospitals and practices are within or directly adjacent to Western medicine hospitals.
Absolutely,
and I'm air quoting the Western for all the listeners out there. So it's seen as and they'll refer to each other. So
yeah, very much so. Very much so.
And the crazy thing for me, and I know where this comes from. Don't get me wrong, I'm a middle-aged white guy. I'm very familiar where this comes from now. But the crazy thing is that in the West, we still very much look down upon traditional Chinese medicine.
In many ways we do.
Yeah.
Yeah.
And is there... I remember watching the comedian Brehan saying this years ago, was saying something along the lines of alternative medicine, which he captured the TCM under. And, it becomes medicine when the research is in. That's how we know it works.
Right. They would say that, a lot of people say there's no Western medicine and alternative medicine or biomedicine alternative. There's just medicine. And yes. When it works, we just call it medicine. That would be true in the West if we actually evaluated the evidence around all of these things like Chinese medicine, which we don't. We also have a very limited view here of what quality evidence is. And just like there's different quality levels of scientific evidence, if you have, say you have a randomized double-blind randomized placebo-controlled trial with 20 subjects, that's both high quality evidence because it's randomized, double-blind, placebo-controlled, but also low quality because it's only 20 people. Yeah. You take that and you expand it out to 2,000 people or 20,000 people, all of a sudden that evidence becomes much higher quality. You could take and we have a lot of correlative evidence that is used in clinical practice in the West and considered high quality, even when it's not randomized, double-blind, placebo-controlled. It just shows benefit for a great number, such a massive number of people. And that's things like not eating too much cured meat because it'll cause colon cancer, or not smoking because of, we do have causative evidence for those things finally now, eventually, but it's taken a long time to get there. But it was so clear for so many years before we had the causative evidence that the correlative evidence was just so huge. If that standard is not applied equally to alternative medicines. Yeah, and so exactly. if you look at things in China, we don't have, for example, great quality causative evidence showing that Chinese medicine is effective against SARS-CoV-1 or SARS-CoV-2, like the original SARS from the early 2000s, or COVID-19, the virus that causes COVID-19. What we do have is massive correlative evidence showing that people who utilize Chinese medicine when they're sick with those things, in addition to Western medicine, have at least a double rate of survival. Okay. At least a half of a rate of mortality. So there's probably something there. Yeah. In addition, in China, tradition is considered a form of evidence because the scientific method has only really been around for 150 years, and it's only really been applied to Chinese medicine for the last 30 or 40 in terms of a research environment. And so it goes back a little bit further than that. They were doing stuff in the 50s and 60s, but it's really just expanded a lot the last 30, 40 years. But prior to that, we have 5,000 years of empirical evidence and clinical documentation. Doctors have been keeping chart notes in China for a very long time. And and you can also go back and historically see what kinds of formulas have come and gone and what kinds of formulas have stood the test of time amongst Chinese medicine physicians. And when you see something that's, some doctor writes about it in his personal annals, and it goes through a fad. People will try it out, use it. It's popular for 20 or 30 years, and then it kind of fades out. You can see like, oh, okay, that didn't really stand the test of time, versus some of the formulas that we have that we use the most often in a clinical situation to this day are 2,000 years old and have been used consistently for 2,000 years for pretty much the same purposes. And we know exactly what they're for, and we know they're likely to be effective. And these things have, again, made their way into Chinese culture too. The first time you get sick in China in most environments, you won't actually go to the doctor. You'll go talk to your grandma, or you'll go talk to somebody who's older, who's been using Chinese medicine for a long time. And they for many common complaints, they'll just say, oh, you need to take Xiao Chai Hu Tang, you need to take Yin Chao San, you need to take Liu Ai Di Huang Wan, something like that. You take it, and then if you get better, great. And if not, then you go to the pharmacy and you talk to a pharmacy tech who might have a high school education, but has been working in the pharmacy for 20, 30 years, sees what people are buying over and over for this kind of thing. They'll say, oh, get that. And you take that. And then if you have a very complex situation and both of those people are throwing their hands in there, then you go see the doctor. But, it's built into the culture, what works. And tradition as a form of evidence is a valid form of evidence when you have that much when you have that weight of tradition.
Yeah,
in the
when
West,
you
we
have huge
just don't
numbers
have it.
behind you.
Yeah,
Because that is exactly kind of the point I was hoping you'd bring up. Because other than the say, I mean, we call it Western supremacy, white supremacy type, not KKK style, but we are better than. Right,
Yeah,
we know
exceptionalism or something like that.
Western medicine is clearly better because everybody else is a peasant, right? That is fundamentally what a lot of this discussion that's the direction a lot of this stuff tends to take when you talk to certain people online. When you say, hey, this person has in this country they try this for certain illnesses, they try this is their tradition, and indeed for 5,000 years, I mean, and probably longer, when you say that, because in the West we are very much used to fad
Very
approaches,
much.
right? Very much.
We embrace
that
it.
is
We love the fat approach.
Exactly. That's kind of what we do, and therefore it's very easy, I suppose, for medical professionals or people just generally speaking who are very much into the approach that if a study isn't peer reviewed, is not a real valid study, right?
I mean, sometimes that's true.
Oh yeah, don't get me wrong.
Studies out there, but yeah,
most things on PubMed
yeah.
are complete nonsense. But we have a very much a peer review doesn't always look like peer review. Do you know? Do you know what I mean? As in, the peer review can be 5,000 years of tradition that has been found to work because it has been used. That's the peer, right?
That's a lot of peers. That's
exactly.
a lot.
There's a lot of people that stuck with it, and like you said, there's something to it. Then, whereas what we tend to do is we try something for 5-10 years, and then I'll go back. Low fat diet. Low fat diet's clearly better than a high fat diet, for instance, right? That was the thing in the 80s, and we take all the fat out of the yogurt, we add some more sugar to the yogurt, and all of a sudden it doesn't turn out, it's not a real solution. And I'm not saying
it's not really that much better than a full fat yogurt.
It's kind of potato sort of thing, right? And I'm not saying people shouldn't try low fat, and I'm not saying people should go full keto or anything like that. I'm completely diet agnostic. I'm just saying that we try things for 10-15 years, then we find they don't work and we discard them.
And there's a funny thing about that, a funny anecdote in Chinese medicine, speaking of peer review, which is that you'll see, if you go back and read a lot of these doctors' memoirs and things like that, someone who was practicing in the 1700s and at the end of his career, he's very, famous doctor, treats imperial family members or, really well known in a region, and will write a memoir at the end of his career talking about all these things, and then and talking about the formula that made him famous or something like that. And so he writes these beautiful stories about how he cured all these incurable diseases, and obviously trying to leave a legacy for himself. And 20-30 years later, somebody else who's also a famous doctor will write their memoir, and they will quote Dr. A, the original one, and they'll talk about what an idiot that guy was and how he hurt people because he was absolutely diagnosing wrong. They're not kind. Like if somebody, there is a lot of and this is needed for high quality evidence, is for, this is part of the scientific process. And before we had the scientific method that we call today, where you're isolating one variable and, testing repeatedly for that, which is a great thing to do. If you only have one variable, you only had peer review. You only had other people in your same profession who were trying the things that you had said were excellent resources and medical resources. And if they didn't work, they would call you out. And we like to think that science is infallible, but there is, talk to anybody who works in academia, the pressure is there to publish and to get repeatable results. And if somebody calls you out on your data, or God forbid you work for a pharmaceutical company and you get a study that comes back showing that your drug is not effective or is harmful, you're out of a job. And so some of these people are publishing bad data, are paying for bad quality peer review. And we hope that gets sussed out over time, but it doesn't always. And some of these things even make it, will make it all the way through FDA approval, make it into the general populace until the weight of evidence becomes so obvious that this process was flawed somewhere along the way, that someone was corrupt. It's one of these things where you look at tradition is not infallible either, but it is a way of cataloging evidence that's not necessarily that works very well for systems biology-based approaches, which is a fancy way of saying holistic approaches, where there's more than one moving part. There's more than one variable. And so when you're working in a population basis, such as, your podcast, your content is mostly about postnatal recovery, about postpartum recovery for postpartum mothers. And that's a demographic. So in Chinese medicine, we have very specific categories of formulas, of dietary recommendations, of lifestyle practices that are utilized for postpartum mothers, specifically because we have thousands and thousands of years of tradition showing how, people are just happier when they do this and have better quality lives. And we even know that some of the very difficult to treat diseases that we have very commonly nowadays are clearly seen in a population of postpartum women. Autoimmune disease, fibromyalgia, susceptibility to post-viral conditions, which is my own practice specialty, things like long COVID, chronic fatigue syndrome, fibromyalgia is often post-viral, IBS, where your body is more vulnerable after you give birth. And if you don't recover properly, the possibility for a serious and difficult to treat disease setting in becomes much, much more likely.
Yeah, and it's fascinating that you brought up like fibromyalgia and all that type of stuff, because it's the little bit of prep, and everybody who listens to this will know that I don't do a tremendous amount of preparation for my podcast. Because I'm a busy boy and I've got stuff to do. But every now and again, I tend to look at stuff. The incidence of fibromyalgia type things in nations where they adhere to some form of postpartum care. And by postpartum care, I mean, I don't like to call it self-care, because that implies that you book a weekly yoga class or something like that and book a facial.
Right.
But postpartum care as in...
and it should be done by a community. It's not just about one woman making a smoothie for herself.
Yeah, exactly. That's it. So women who practice the sitting the month, and again, I will link to the old podcasts I've done on this, but where other people take care of the woman, where all the food is basically kind of planned out, but at least it's highly nutritious and it's focused around recovery. Right.
Yes.
So
it's both highly nutritious and easy to digest.
Exactly. Yeah. Exactly. There aren't huge quantities of tricky fiber. And all that sort of stuff. You're not eating tons and tons of sweet corn type stuff.
No.
But it's the instances seem to be, from what I could find, significantly lower of cases of where women have that postpartum period where they really are managing and the community helps them manage to look after themselves and the baby, rather than the washing and the dishes and all that type of stuff, and the husband.
Yeah.
The consequences seems to be that you have significantly fewer postpartum issues on the back of that. Now, this sounds ridiculously obvious when you say it out loud, right? As in, if you take good care of yourself after a traumatic or life-changing experience, such as giving birth and pregnancy, you will have a better health outcome. It sounds remarkably straightforward, right?
It's very pedestrian.
Yes.
Well, of course you will.
Of course you will. And nobody
and
does
yet we
it.
do such a terrible job of it here.
Yeah, it is absolutely atrocious over here. So what can, other than looking after yourself a bit better and reading all the books and all that type of stuff immediately postpartum and planning it a bit during your pregnancy, what do you find is one of the issues that you're like, okay, this helps with fibromyalgia? Is it are you going back to lifestyle changes predominantly?
Do you mean once the fibromyalgia sets in, or if a woman's experiencing, a flare of it in a postpartum period where she was in remission
pretty
during her
much,
pregnancy?
yeah.
Oh, uh, so the way that Chinese medicine approaches fibromyalgia is that it is a what we would consider a layered syndrome. So there are multiple causative factors, multiple contributing factors,
Yeah.
and addressing those in the right order is the best way to recovery.
Okay.
And so if we often see it catalyzed by a virus. So it's something that many women will experience after they get sick. And then they think they're better, but the pain stays. Like when you're sick, when you're fighting a flu, when you're fighting COVID, when you're fighting any kind of not any kind, but many kinds of viruses, your body's levels of inflammation go up. IL-1, IL-6, these kind of interleukins, the inflammatory markers, C-reactive protein, all of these things will be measurably higher. Right. And in a healthy body, they should resolve after the virus is gone. So, and like, it hurts when you have a fever. I had the flu last year. I was in so much pain. And that's why traditional cultures will use things like diaphoretic herbs, like a sauna, stuff that helps you vent, that helps you sweat it out. And then, and rest is critical.
Yeah.
And unfortunately for many postpartum women, for many mothers, they don't get a chance to rest because they're so isolated in the West. They don't have the community support. You get sick, too bad. You got to go to work. You still got to, you got to take care of your kids. You got to get up during the night. You don't get a chance to be sick. You don't get a chance, it's not that if you're laying down in bed with a fever, it's not that you're being lazy. You're working hard on the inside.
Yeah.
And you need to recover. You need to rest. You need extra time. A lot of people don't understand how critical that last day of rest is. I had a patient yesterday who she had been in complete remission from fibromyalgia, got the flu this year, went back to work, went back to the gym and to work. She's a realtor. On the first day that her fever was gone. She was still tired. She still felt achy a little bit. And she was like, I need to get back to work and I need to exercise. I got to hit my gym goals for 2025. And she went to the gym. She pushed herself real hard. She came home, she collapsed and her fever came back. And, and now she's in a real fibro flare. She's got, the fatigue is immense. We'll get her out of it. But it's you need to take that one extra day to let yourself rest after you feel better. Like you get through the most of the virus and then you're like, okay, cool. I can go back to work today and go back to the gym today. Don't do it. Take one more day. Even if you open your email and respond to one or two things, even if you go for a 5-minute walk outside, if it's sunny, like get some fresh air, do that. That's fine. Move your body very gently. Don't push yourself. Don't overdo it. Take that extra day. And unfortunately for many women in the West, they can't. The pressure is just too high. Yeah. But that's where we start with recovery is like trying to, like, I'll ask my patients, who can take care of your kids today? Who can you delegate something to at work today? Because you're pushing yourself too hard here and your body does not have the resources to recover. Can the kids be instructed, wake up dad if they need something in the middle of the night? Yeah.
No, but because that's a fascinating point, because that's what I tend to find with a lot of my clients, that the idea of going back too soon and then all of a sudden indeed gym or work or whatever, childcare, just whatever stressful situation you can add to life, they'll tend to go back to that. And then a month later you talk to them and I just can't shake this off. Right? It as in, I'm still tired. I don't know why I'm still tired. I had the flu a month ago. And it's because you never really had any real recovery. You never finished, to put it in very Western terms, there's a reason they tell you to finish your dose of antibiotics. the whole course. Right? It
Right.
is
Your
you
symptoms
don't
may be
stop
gone, but you're
halfway.
going to take those last 2 or 3 pills.
Exactly, because
Yeah,
they make the difference.
absolutely.
And that is very, like you said, due to societal pressures. There's no, by the way, for anybody listening, I'm not blaming anybody going back really soon. But it is something that is kind of how we've been set up, isn't it, to function over here in the
Hmm.
West.
Yeah. It's still, the wild, wild West culture in the United States, especially, I think kind of kicked in where it's very very individualistic.
Yeah.
It's very ego driven. It's very adventurous.
Mhm.
It's very much like, you want to do this amazing thing that you might die trying.
Go
Cool.
for it.
That,
Yeah.
we're going to celebrate you,
Yeah.
get rich or die trying kind of a thing. Unfortunately, for better or for worse, that leads to a situation in which we don't support each other.
Yeah.
We're not, a lot of people have forgotten the power of teamwork, the power of having a large family organization. We see nuclear family is what's treasured in the West versus the extended family. And it's a form of torture for a lot of people, especially women. It's a form of isolation.
Yeah, it's a really, really difficult spot to find yourself in. Cool. So going back to the thing. So do you tend to start with explaining the importance of rest
I
when
do.
and recovery rather
I
than,
do.
because to hark back to the American TCM approach, and anyone, and you must cringe a little bit as well. Well, maybe you don't, I don't know. But it's when I first started meeting holistic healthcare professionals 15 years ago, holistic meant something else than what it means now.
Hmm.
Almost people have almost taken the word, because taking a holistic approach is a sensible approach, right? We look at everything.
It should be,
And
I think.
it should be.
It's often,
It should be the
it's often
norm,
not.
right? But it's been almost co-opted by people, let's say, whose first instinct is to say, "Oh, we'll sell you loads of supplements," and then
Right.
but that seems to be the way the way it's gone. So you start by asking people, telling people to rest more than anything. And what kind of food choices do you tend to come
Um,
across that
uh,
you're like, this is useful for recovery?
the kinds of things that they should have been eating or should have been fed postpartum.
Right.
And so it's often, I joke sometimes that if I were to write a book about diet, it would be called the soup diet.
Yep.
Cooked brothy
Yeah.
soups, cooked vegetables, little bits of lean protein,
Hmm.
highly nutritious, very nutrient dense stuff, but it's also easy to digest.
Yeah.
I think porridge is underrated as a health food. I
Hmm.
think, thin porridge, made from a little bit of rice or oats or barley or millet or quinoa or buckwheat, something that you just cook the bejesus out of it with a lot of
Yeah.
extra water, add maybe an egg or a small piece of fish for some
Hmm.
protein, add some cooked vegetables, add some mushrooms, add some spices to that. In the West, we often think of porridge as like the only thing we have is oatmeal, or maybe you grew up with like cream of wheat or something like that. And it's
Hmm.
usually, you add fruit to it, a little brown sugar, some maple syrup, maybe some cinnamon,
If you're
and
lucky,
it's
yeah.
delicious. And there's nothing wrong with that either. Like
Hmm.
that's a great way to get, a lot of healthy carbs in and some fiber and some spices, but savory porridge, which is really just soup.
Hmm. Yeah.
I think it's underrated as a health food. And it's people who are in chronic pain they often, almost always, have some aspect of digestion that's compromised.
Hmm.
And so they need, that's a stage of treatment. That's stage 2 is focusing on the gut. And a big part of that, and you can start it at you should start it at the beginning, is getting rid of the stuff that you're eating that's making you sick or keeping you sick.
Right.
And it's the hyper processed, ultra processed foods. Those are not good for anybody.
Hmm.
Those things are very digestible in some situations though. So,
Yeah. Yeah.
like we don't want you eating potato chips, but if you want to have a couple of crackers, some gluten-free crackers or something like that, is a very easy digestible starch. Okay, cool. If that's sitting well, but we want to get people away from a lot of cold food, in particular, cold beverages, ice cold stuff, smoothies, ice cream, eating frozen fruit. That cold stuff is very hard on the body. It takes a lot of metabolic activity to warm it up to where it can be digested. And the effect of putting cold on the inside of your digestive system is the same as putting ice on an injured part of your body. It's going to reduce inflammation because it's going to reduce blood supply. Right. But in a healthy body, you need blood supply to heal. And you need blood supply to your digestive organs for them to digest your food. And that's why most traditional cultures use warm food almost exclusively, and especially as medicine, especially for people who are in a chronic illness situation.
Yeah, because that's fascinating, because it's the sort of thing that we have touched on before on the podcast, the importance of understanding what you're eating. And even when you're talking about putting ice on muscles, right? The old ice bath approach, right? I remember one of the tennis players in the UK, Andy Murray, who, to be fair, was like number one in the world for a little while. He did this little follow me around for the day documentary, and you watch him do 400-meter sprints until he vomited, until he threw up, and then he goes again, and all that stuff. If you want to be the top guy in the world, that is top tennis level, top athletes are never healthy people, right? They're just machines, but they're never healthy. They're just fit for function. Yeah. Every single one of them, and I've worked with one or two tennis players, every single one of them is A, completely out of their head, and B, constantly struggles with injuries and all that type of stuff. But what he always used to do after his training session was jump in an ice bath, right? And you remember, you see this in American football things as well. They jump in. Nobody does that anymore, other than Wim Hof followers, and those guys are all completely out of their mind.
Wim Hof, I don't know specifically where he's at. He took a lot of his breathing methods from Tibetan Buddhism, where you can use breath work, you can use Qigong to warm up your body to the degree that you can safely sit. You see these monks, they've been doing this for thousands of years. Yeah. They go up and sit down in a glacier and just meditate, and you'll see the steam just rising off from the ice around them, just through breathing. And, he took that kind of method and made it extremely popular. That's valid. And you can do that and go dunk yourself in an icy pond and get the shock value from it. Yeah, and the whole fad about ice baths and things like that, it's there is, for some people, not for, extremely depleted individuals like postpartum mothers most of the time. But in a very replete person, like a young man who's a professional athlete is a great situation for this. Yeah, if you want to dunk yourself in ice for 30 seconds, for a minute, like that's okay. But putting ice on a bruised shoulder for 30 minutes, not a good idea. You get it's fast track to arthritis.
Yeah, exactly. Hardly anybody uses ice anymore for any sort of injuries, as far as I'm aware. And I know I'll probably get one or two emails in from people saying, well, actually, I still do it. And it's fine. But the ice pack is kind of, it's nice for bruising. Don't get me wrong, gets the bruise down. But other than that, the old pack of peas. It constricts
blood vessels.
Yes, so exactly.
You get less of a bruise, but you also heal more slowly.
Yes, exactly. But, at least you don't get a big lump on your head if you've bumped your head. Do you know what I mean? And when you're bald like I am, lumps really matter. I've already got a lumpy head. But it's interesting because, like you said, it's to still have that approach of loads of cold, hard to digest foods. It's a strange one because, of course, what we never discuss, and I'll say this for postpartum recovery, at least in the UK and the US, as far as I know, is dietary changes to help with recovery. Right? It never gets brought up. Mum gets handed the baby, mum leaves the hospital, mum goes back to probably the other child, and then back to work, and Mum has sandwiches at lunchtime because Mum's always had sandwiches at lunchtime, and you need to eat, right? And
Yep.
nothing really changes. We immediately go back to our old diet, and even if that
Yeah.
diet is a healthy diet for someone who is not postpartum, that doesn't translate to it being a healthy diet for a postpartum person. Does that make sense?
Yes. Yes. Yeah. The context is everything.
Yeah.
What you eat for health at one part of your life may not apply somewhere else.
Yeah.
You've got to treat yourself like you have the flu. You've got to treat yourself like you're very old. You've got to treat
Mm.
yourself like you're, and you've got to have people treat you that way too. Unfortunately, for not forever, but for a period of time until you really recover. You need to eat food that's very easy to digest.
So how long would you recommend that period is? And even
Oh,
for people, I know that's probably how long is a piece of string sort of question, but
yeah, to some degree. I mean, they call it sitting the month for a reason. That's a
yeah.
fairly universal tradition of, giving yourself 30 days. And I think that's really important. I think I think doing things that help you pay attention to your body's own inner state and state of vitality are really important. In
Mhm.
China, people commonly will learn to assess their own tongue. Tongue diagnosis is a big
Mhm.
part of Chinese medicine. Like you just stick your tongue out in the mirror, shape,
Yeah.
color, how thick is the coating, what do the veins underneath it look like. It's very easy to tell the state of your body's internal ecology. Are you damp or dry, hot or cold? These kinds of things you can tell in an instant just looking at the tongue, and you can change your diet appropriately, going
Mhm.
for things like drinking warm water or herbal tea throughout the day, adding ginger to your food or drinking ginger tea. Should you be more on the soupy
Yeah.
diet, or is it okay to have some chicken wings,
Mhm.
like that kind of stuff?
Yeah. So did you say, because I do want to go back to this, that fibromyalgia and gut health, as in IBS type stuff, is linked? Because I
Yeah,
see that a lot
very much,
in
very closely
postpartum
linked.
women.
Yes.
Because
So
it's
fibromyalgia.
yeah. Sorry,
Would you
on you
like me
go,
to just?
please. No,
Oh,
please.
yeah. So we break fibromyalgia treatment down into 4 stages for the
Right.
most part. There's a stage 0, and there is a which is just reflection,
Mhm.
noticing what kind of breathing your body is tending towards, and then doing some journaling. And then there's a 5th stage, which for most people is optional. They don't actually need the 5th stage for the most part. The 4 stages work through different layers of what we call excess in Chinese medicine. So the first
Mhm.
stage is infections. We call that wind. The second stage is dampness, which has a lot to do with the IBS presentation. The third stage is autonomic dysfunction. So that's the role that stress and trauma play
Mhm.
in catalyzing fibromyalgia pain. And the fourth stage is blood circulation. And so
Right.
whether that's microclotting, whether it's elevated prostaglandin levels, that's where we will do things like regulate the woman's monthly period, make sure it's not crazy painful, super heavy,
Right.
doesn't have giant clots in it, things like that. And then the 5th stage is where we tonify, we build them back up.
Mhm.
So for many women, if in an acute postpartum period, they will need to do that 5th stage for a brief period of time,
Mhm.
and some of them will go into remission just from that, unless they've caught a new virus, unless they have predominant IBS, running to the toilet 5 times a day, or can't poop at all. That's a great example.
Mm.
But for the most part, we run through stages 1 through 4 in order, and then we'll do stage 5 just for a couple of weeks, just to kind of as a finishing move. And then they're usually in remission for a very long time. They can come out of it with a new immune cascade. So catching a new virus, occasionally getting a vaccine.
Mhm.
I typically recommend my patients follow their doctor's advice in terms of vaccine scheduling, but
Yeah.
that is a known side effect of vaccines for people with a
Mhm.
history of fibromyalgia. That anything that activates the immune system can trigger a flare of pain. Um, if they go through a crisis in their life, a period of prolonged stress, have another kid, uh,
That'll do
experience
it.
a
Yeah.
motor vehicle accident, something
Yeah.
like that can cause a flare of pain. That's neurogenic pain. And then we can, or directly, being injured, that'll do it
Yeah.
again too. And so then we can do, we'll go through whatever stage is appropriate, but they usually come out of remission a second time much faster than the first.
Yeah, that's like muscle memory almost, then, isn't it? It's as in,
So I don't, yeah, I don't know how. I think this is my hypothesis, is that
Mhm.
it's easier to come out of remission a second time. Sorry, easier to go back into remission a second
Yeah.
time and become more resilient over time because uh, the patients learn to accept the pain as a signal from their body, like as a warning sign that
Mm.
something is out of balance, and they take action towards changing that very quickly.
Right.
And so the severity of injury, the severity of chronic inflammation is less. Even if the pain is more severe, they'll notice right away, oh, this is wandering pain. I need to do stage 1 again. They'll go do
Mm.
some nasal humming. They'll do a sauna and sweat. They'll drink the appropriate tea. And then, within 2-3 days, they're out of pain. Uh, if they have a long history of post-traumatic stress disorder and they've made the changes in their life that are necessary to be free from that, they've done the breath work, they've gone to therapy, they've taken the herbs that help their gut brain axis recover from all of that, and then they see, they get fired from a job, go through a divorce, be
Mhm.
in a motor vehicle accident. They're not physically injured, but they're really shaken up, and all
Yeah.
of a sudden some of that like electrical or burning pain is coming back, because that's the pain that's typically represented in stage 3. They
Mhm.
know, okay, it's Shayasan, it's this breathing exercise that we do called the huff and puff. Maybe doing some foot soaks and a few days of that, and they're regulated again.
Mm.
And that's why, I think education, like I was talking about at the beginning, most Chinese medicine is part of Chinese culture,
Mhm.
all of it, really.
Yeah.
And so that's what I try to teach my patients, is how to take care of themselves and how to take care of their own families. Because like, I feel like if a woman goes into some kind of disease or illness situation in a postpartum period, the greatest the greatest healing for that I've
Mhm.
heard from them is not only their own recovery, but then being able to help their own friends with it, help their own
Mhm.
community with it, and potentially, like, if they have daughters, help their daughters with it when their daughters have children.
Yeah.
And making effective medical care part of the culture of how we take care of each other, I think is probably the capstone piece of recovery, because it again, just like being isolated causes so much illness, causes so much
Mhm.
suffering. Taking people out of isolation can cause so much cultural healing.
Yeah, no, that is an excellent point, because it is something that I've come across quite a lot, where I am. I see maybe, I don't know, 15 people a week or something like that. I don't see a tremendous amount of people because I don't like working that hard anymore now that I'm 50. But it's basically I see 50 for a lot of my new postpartum clients. I am the only person they see once a week, other than their husband and
Yeah.
maybe their parent,
Yeah.
who pops in
Yeah.
every now and again. And as I always, as I always tell myself, and I always tell them, I'm a lovely person. But if I'm the only guy you see once a week, oh, you need to be
It's
hanging
not.
out a lot more. I mean,
Yeah.
it is, but it's ridiculously common. And I don't stay in a small village, right? And Edinburgh is still the capital of Scotland. And it's not a huge city, but still 700,000 people. There are
Yeah.
5,000 women give
Sizable
birth
town
every
for
year.
sure.
Yeah,
Yeah.
5,000 women give birth in this city every year, right? And yet I can be the only person they see once a week. That is, it can't be good for your health. And the problem
No.
we have now, of course, is that there's a lot of, and listen, social media is great and all that type of stuff. But there are downsides to it. If your only connection is to other people via social media, then it's very tempting to fall down a rabbit hole of support groups that are not necessarily
Mhm.
supportive.
Nope.
And you must have come across, because I had a look at your YouTube
Oh,
channel, which is phenomenal, right? So
thank
so
you.
you it's completely different from a lot of other, let's say, recommended Facebook groups. Do you know what I mean? But where
Yeah.
support is judgy, or it's sales, or it's MLM type
Uh-huh.
stuff, as in, and it's
I
very easy
have
to fall down
seen
that rabbit hole.
so many of those groups where it's run by somebody who is professionally sick.
Yeah.
And by that, I mean they are being financially compensated to stay sick so that they can consider themselves kind of the alpha sufferer.
Mm-hmm.
And they will push scams,
Mm-hmm.
or they will say nothing you do will ever work except follow me.
Yeah.
Which, like, that should be such a huge red flag. I mean, that's running a cult. And it's that's not to say that all support groups are bad. Find support.
So support is great. Yeah.
But support should be a series of tools. It should be a series of personal connections. It should not be a religion. And
for sure.
and I hope people don't take that out of context. Having a healthy spiritual community can be a wonderful blessing. Being part of a church group or what, like that's community ties are fantastic in traditional cultures, often because of religion and because of church groups. But Facebook groups, watch out. There's a lot of toxicity in there.
And the funny thing is, it's like what you say, I come across a lot of much more straightforward cases, diastasis recti and all that type of stuff, separation of the core of the stomach muscles, essentially, which is just you put that together with some exercise. Right? It's basically, it is not brain surgery on any level. But the amount of support groups that one of the people that used to work for me used to send me links all the time to support groups, and it was always, this is a lifelong condition. This is stuff that you'll need to manage forever. I'm like, it takes me 3 months to fix all this type of stuff. Any sort of women's health physio takes 3 months to solve this particular issue. And it's like what you said with regards to the professionally sick person, as in, if they're telling you that you will have this forever, and it's usually then dependent on you at some stage handing them money, right? Then you'll need to hand them money forever, right? That is kind of how that then goes. And that is a huge. That's a huge red flag. When I see someone who said, "I've had this condition for 3 years," well, then you should be giving other people advice, right? And I always tell people this, that if, God forbid, I end up in hospital with, I don't know, cancer. I'm 50 years old, so it's going to be cancer, right? That's pretty much, if I end up in hospital, I'm either going to break a leg or it'll be cancer. If I'm in a cancer ward, I don't take my advice from the other patients. I take my support from the other patients.
No,
right?
You can have great conversations with them, but you should take your support from the oncologist.
Yes, I tend to listen to the to the lady or the man who comes in wearing the white coat and has a stethoscope, who at least says, "Hey, Pete, I studied this for a while. I have a treatment plan."
You want to listen to the person who successfully helped thousands of cancer patients get into remission and hopefully stay that way.
Exactly.
Not the people who have their only experience with it is their own condition. Mm-hmm. That's valid experience. Lived experience is valid experience, but it doesn't make you an expert at a demographic level.
No, exactly. And that is where, to go full circle with kind of where we started, I find that is where that's why I like your stuff and your YouTube channel and all that type of stuff, is because it is separate from the American TCM approach, which is very similar. And I'm not crapping on every practitioner that uses that approach. We have them in the UK as well, by the way. There are a lot of good ones, but there is a tendency to add an element of lived experience through it that doesn't necessarily have that becomes dominant when it comes to dealing with treatment plans.
Right. If it supersedes evidence and tradition, that's a fallacy.
Yeah, exactly. And that's, like I said, that's why I liked your stuff a lot. And, if you put in the effort to go abroad to actually study the real thing rather than take a 6-week course, which some of the courses in TCM are 6 weeks in the UK, by the way. For anybody
some
listening.
Some of them are 8 hours. There.
8 hours. Well, there you go.
Yeah.
Jesus.
Yeah. It's scary.
I wouldn't even let someone stick a needle in me after 8 hours of training. I mean, it's I wouldn't even let someone stick a needle in my dog after 8 hours of training. That is mental. Cool. We've touched on a tremendous amount of stuff. Was there anything else you wanted to cover?
No, that's great. Thank you so much for having me on, Peter.
No, that was superb. That was really, really good. On that happy note, I will press stop record here. And press stop record is exactly what I did. As always, thanks so much to Brehan for coming on. I will obviously link to Crawford Wellness website and all that, all his stuff. His YouTube channel is phenomenal. It's really, really good. The videos he has are not just entertaining, and they're not full of nonsense, like I said, which you get with a lot of the American style TCM practitioners. I like his approach. I think there's a lot to it, and check it out. I'm a big fan. That is me done for yet another week. Next week we are talking attachment theory and all that sort of stuff, relationship management and how it relates to raising kids and all that sort of stuff with Beth Milterman. You're gonna love that one. That was a mind-blowing conversation for me in more ways than one. Right. So that is up next week. For now, here's a new bit of music. You take care of yourself. Peter@healthypostnatalbody.com, by the way. Right? You know the email address is also in the send us a text thing. Thank you for listening. New bit of music, right? Bye now.